come in. Hi, Stephanie. How are you?
I could be better.
Yeah, I bet. My name's Carrie.
And I'm Chelsea.
Miss Chelsea, we're gonna get a few vitals and do a little assessment on you, if that's okay. All right. I'm gonna wash my hands real quick. Perfect. Sorry, I can't wash them.
Thank you. And then we're going to pull the front for privacy.
I'm gonna raise your bed just a little, so you're a little jerky ride. Did you sleep good last night? I did. Good. Did you have a good breakfast?
Alright, so we're going to start with your neurological assessment. Can you tell me your first and last name?
Stephanie Bates.
Alright. Can you tell me where you are, Stephanie?
I'm in the hospital.
Okay. Do you know what day it is?
I think it's Tuesday.
Okay. And then, do you know why you're here?
I was in an accident.
Okay. Very good.
Right, check your toes.
2268. Very good.
Alright, while she does your pulse, I'm going to go ahead and check your eyes here. So go ahead and look directly at my nose. Just into the light. Alright, and then I'm going to have to follow the pen.
Have you noticed any changes in your diet or appetite? Have you been nausea, respiration, or diarrhea?
Temperature.
Can you tell me your last bowel movement and how was it? Was it hard, soft?
Good.
Normal?
97.9. All right. I'm gonna have you put your hands out like this. Don't let me push them down. Good. Do the same to me.
Very good.
Squeeze my hand. Tight. Oh, good job. Seems like we're getting a lot stronger. PC helping? Okay. Very good.
Alright, and I know they asked you to, when you were admitted, but are you
Hi, Stephanie. I am just going to check your skin condition. The color looks good. You look nice and clean. How you feeling? Pretty good. Good, good. I'm just going to check for your temperature and you're not moist. You feel nice and dry. That's great. I'm going to check your chest for any dehydration in the trigger for tenting. Perfect. You look nice and hydrated. I just want to check your incisions. How are they feeling?
Pretty good today.
Good, they look great, and I don't see any other lesions anywhere. All right.
All right, Stephanie, I'm going to do a little assessment on your respiration. I'm just going to pull your gown down a little bit. Here on one side, I always want to hear on the other. I'm going to sit you up. And we're going to do 6 signs on the back. I'm going to go the top, middle, and lower lobes. Good. You sound very clear. You're free of cracks, wheezes, crackles. Breathing's good. I'm just going to do a little assessment on your chest. Make sure there's no lumps, bumps, bruises. Your incision's looking good. And since you don't have any oxygen or a nasal cannula, I'm not going to do the old sternal rub on you. You're good to go. So, good. You keep up the good work. All right. I'm going to get a quick pulse ox on you. This checks the oxygen in your blood through your hemoglobin. Closer to 100 is good. You're at 97. Great. Great.
Stephanie, we're going to go ahead and put you in lateral recumbent position so we can get your apical pulse. Alright, so we're going to roll you towards me. 1, 2, 3. And we're going to pull the leg over for stability. Alright. Thank you. Sounds like it's at 88. So we're going to go ahead and roll you back. 1, 2, 3. got your legs uncovered, I'm going to go ahead and check for edema. So we're going to push down. Okay,
Looks like it bounces right back up.
bounces right back up. And then we're going to check for your pedal pulse. Okay, it's normal and bounding. Alright, so we'll go ahead and cover you back up. We're going to go ahead and check for your capillary refills here. So we're going to push down on your nails. It should take about 3 seconds or less to fill back up, and it did. Very good. Alright, and then you have no pacemaker, and no IV sites, so you're good to go.
We just wanted to make sure that you've been eating properly, that you still have an appetite, no diarrhea or vomiting. We see that you've been drinking your fluids, so that's good to stay well hydrated. We're just going to look at your belly just to make sure everything's okay down there. We're going to pull the blanket down pretty far, just so you're aware of that.
All the way down to the bottom of the pelvic area, so we might expose some of the pubis. Okay. So the first thing I'm going to do is just check to see you have no incisions, no abnormalities, no lumps or anything. It looks pretty good. I am going to listen to your bowel sounds. Alright, not too much gurgling going on in there, which is good. The next thing I'm going to do is feel around, see if I feel any lumps in there. So first I'm going to do it softly. Let me know if you feel any pain. Okay, good. And next I'm going to go a little harder, make sure I don't feel anything in there, any lumps. Okay, everything feels pretty good. And the next thing I'm going to do is just percuss to make sure there's no fluid in there. Alright, very good. Go ahead and cover you back up here. Alright, and we're done with the abdominal assessment.
Alright, Stephanie, we are going to
What about any recreational drugs?
assess your vaginal area and your rectum, if that is okay with you.
That we need to know about?
Okay, great, thanks. Before we get started, I just have a few questions. When you are using the restroom, do you have any issues with the odor of your urine or the amount, your output? Nothing? Color seems normal?
What did your mom
Okay,
have?
perfect. And you don't have a catheter in, so you're able to go by yourself, so that's good. Alright, we are going to go ahead and take a look, make sure everything's good. Bring this down.
No.
We'll cover you up.
Nutritional habits that you've been doing?
I like desserts, everything else.
Oh, okay, yeah. What about exercise? Do you do any activities?
Yes, I exercise.
Okay, and are you safe at home?
Yes.
Alright.
Then, how about your sleep patterns? Have they been good?
Yes.
Alright.
Alright, and
We are just gonna
just because
lift
you're
your
making
leg
some
up
need to know patterns
in
sexuality.
front of me so we can get a good look. We don't look, nobody else will. We wanna make sure that everything is
Right
okay
now,
down there.
You participate in sexual
Okay, you
activity
comfortable?
with female.
Okay, good. Alright, I'm just gonna lift this up real quick. Take a,
Yes, because sometimes it.
let me put some gloves.
Hit the butt.
Get some gloves on so we can take a look down there, make sure everything is okay. Any discomfort right now? Okay, good.
Okay.
Now, lift this up.
Again, how have your roles and relationships been?
There's,
No lesions, no
Okay.
discharge.
And, are you,
Everything looks
you
good
just been
there.
on
Feel
just men,
okay?
female, both? Men?
Wonderful. All right, we are gonna
Turn you on your side here.
And what about, social support?
get 1, 2, 3.
When you're struck, do you do have
Put you in the
any,
sim position.
rituals that you do when you're trying to release stress? Breathing.
All right.
Good. All right, now
Your
Melanie,
rectum
here's
looks
gonna go ahead and
good.
get some
There's no
vitals, and I'll see you shortly.
Okay. Just need to get a quick
No
sip of
bleeding.
Vitals.
Good to go.
Let's start off with your temperature.
Come up higher.
Get y'all, okay. Just get y'all covered up. Thank you.
Alright, Stephanie, so we're just gonna go ahead and check your, range of motion and your ambulation, but because of your broken femur and your pelvic, we know that you're not ambulating by yourself, but we are gonna go ahead and lower your blanket. Alright, so we'll start with your arms. We're just gonna kind of rotate your arms, just to the point of pain. So you let me know if you have any pain. We're just gonna go up, down. Then we're gonna go up, up. Same thing. And then we'll go ahead with the other arm. Alright, now we'll just have you rotate your head. Good job, okay. So next we're gonna move on to your legs, and like I said, we know you have the broken femur, so we won't really do too much with that. But I am gonna have you push as hard as you can against my hands. And yeah, still a good bit weak in that leg. Alright, so since you do have the broken pelvis and the broken femur, we're not gonna do range of motion on your legs right now. But we'll finish up with your hands.
Could you squeeze both my hands? Perfect, thank you. That's very good, and I'm just gonna check the nose. Make sure they match. All right, perfect, thank you.
Alright, and we have finished with your assessment, and before we go, can you tell me your first and last name again? Alright, can you tell me what the day is? Okay, why you're here? Alright, very good, thank
Any
you.
questions for us before we go? Okay, wonderful, thank you.
All right, Vanessa, tell me about patient number 7.
Okay, number 7 is a 33-year-old Caucasian female.
Okay.
She was in a car accident 6 weeks ago. She sustained a broken pelvis as well as both of her femurs. She's having a really good day. Mentally, she's still very positive, as she has been since the beginning.
What are you gonna do to decrease her stay here?
Okay, well, she physically is getting better and the pain is getting better, but she's still unable to ambulate on her own
Okay.
because of the, broken bones. So right now, they only have her doing physical therapy 1 to 2 times a week because of all the pain. But I think her pain is under better control. So I think maybe we could go up to 3 or 4 times a week.
Think that she's ready for that?
I do.
All right,
Okay,
sounds good.
thank you.
Next.